9 natural ways to treat yeast infection. Preventing yeast infection is the most effective treatment. To reduce your chances of getting a yeast infection, do the following. Never use a douche or soap inside your vagina. Wear breathable cotton underwear that is not too tight. Change out of sweaty workout clothes or wet bathing suits as soon as possible. Scented soaps and detergents should be avoided. Pads and tampons should be changed on a regular basis. Always wipe from front to back when using the restroom. Spending too much time in hot tubs and very hot baths is not recommended. Reduce the amount of yeast-promoting foods in your diet, such as alcohol and sugar. A yeast infection occurs when Candida yeast overgrows in the vagina, causes an infection. Yeast infections are common, and it is estimated that a majority of women will have at least one at some point in their lives. Get diagnosed first before trying home remedies. Before attempting home remedies, it is critical to obtain an accurate diagnosis. According to an estimate, up to 2/3 of women who have purchased over-the-counter yeast infection treatments do not have a yeast infection. Other infections such as bacterial vaginosis, sexually transmitted diseases, and urinary tract infections can easily be confused with yeast infections. If you're unsure about your symptoms, consult your gynecologist before attempting to treat yourself. Yogurt is ranked first. Consuming plain yogurt with probiotic live cultures and no added sugar may also help prevent yeast infections. Probiotics are live microorganisms that can be consumed to provide health benefits, particularly to the digestive systems. Eating probiotic-rich food can help restore a healthy balance to your gut flora by killing bad bacteria that cause disease and increasing good bacteria. A yeast infection is a common side effect of antibiotics because the antibiotic kills the bacteria in the vagina that prevents yeast overgrowth. When the number of good bacteria is insufficient, yeast growth can become uncontrollable, leading to a yeast infection. Consuming probiotic-rich foods such as yogurt may thus be an effective yeast infection prevention strategy. It is unknown whether eating yogurt can cure a yeast infection. Boric acid is ranked second. Boric acid is a naturally occurring compound that has been shown to have antifungal properties. It contains both probiotics and antioxidants to assist the body in replenishing its supply of beneficial bacteria. According to a 2011 clinical review, boric acid is a safe alternative treatment for yeast infections, particularly when traditional antifungal medication is ineffective. Boric acid may be beneficial for women who have chronic yeast infections and have been prescribed antifungals on multiple occasions. 5. Boric acid is typically administered as a vaginal suppository which is inserted into the vagina and should never be taken orally. If symptoms do not improve after following the package instructions, consult your doctor. Boric acid has not been proven safe in pregnant women, so consult your doctor about a safe antifungal. Number 3. Oregano oil. Oregano oil is a well-known essential oil for its health benefits. According to a 2016 study, oregano oil can inhibit the growth and activity of Candida albicans, the most common type of yeast that cause vaginal yeast infections. Essential oil outperformed prescription antifungal medication in combating yeast overgrowth. Oregano oil is found to be more damaging to the cell wall of Candida yeast than the antifungal prescriptions tested in the study. It should be noted that this study looked at the effects of oregano oil in yeast in a lab setting. More research is needed, however, to determine how to use oregano oil in the body. Number 4. Coconut oil. Coconut oil has been shown to inhibit bacterial overgrowth in the body. According to a 2018 study, coconut oil is an effective antimicrobial agent when dissolved in water. Because yeast infections occur when the bacteria and yeast in the vagina become out of balance, this may be useful in preventing them. Coconut oil can be consumed or mixed into foods like oatmeal or baked goods. More research in the use of coconut oil to treat yeast infection is required. Tree oil. Tree oil is a proven antifungal agent that works well against Candida albicans. A study published in 2020 discovered that tree oil was effective at combating yeast that was resistant to antifungal medication. 8. If you want to include tea tree oil in your treatment plan, consult with your gynecologist. Avoid applying essential oil directly to or in the vagina as well as ingesting it. Apple cider vinegar. Apple cider vinegar has both antifungal and antimicrobial properties. This means that it has the potential to treat and prevent yeast and bacterial overgrowth in the body. Indeed, apple cider vinegar has been shown to be an effective yeast infection treatment in difficult to treat infections that do not respond to conventional treatment. 9. It appears that apple cider vinegar works by preventing Candida from adhering to smooth surfaces. Because the yeast is unable to bind together and remain in the vagina, this helps prevent a yeast infection. Every morning, mix a spoonful of apple cider vinegar into a large glass of water. Do not use vinegar directly on your vagina. Garlic. Garlic contains antifungal properties and has been shown to reduce the number of yeast during a vaginal yeast infection. Garlic, however, has not been shown in studies to prevent infection. Garlic can be eaten raw or as a concentrated supplement. Cook with garlic or try an over-the-counter garlic pill or oil. If you do not experience symptom relief within a few days, follow the package instructions and consult your doctor. Vitamin C can do more than just help you get over a cold. It has antimicrobial and antifungal properties and can be taken orally to aid in the treatment of yeast infections. Vitamin C can be obtained from leafy greens and citrus fruits. You could also take a vitamin C supplement. Lemongrass. Lemongrass essential oil has been shown to be useful in the treatment of Candida albicans. Lemongrass oil vapor can be inhaled. A 2014 study found that the vapor method has been more effective at treating yeast overgrowth. Because this oil can be toxic when consumed internally, it should only be done under the supervision of a qualified healthcare professional. Lemongrass oil is an effective anti-inflammatory agent. Reducing inflammation may help to alleviate the itching and burning associated with yeast infections. When should you consult a doctor? Most over-the-counter yeast infection treatments work within a day to a week. Consult your doctor if you're still experiencing symptoms after a week of trying home remedies. If a yeast infection treatment does not relieve your symptoms, it is possible that you do not have a yeast infection. This is why it's critical to consult a doctor for an accurate diagnosis. Bacterial vaginosis, sexually transmitted infections, skin disorders, and other conditions can all exhibit symptoms similar to yeast infection. Some of these infections can lead to serious complications if left untreated, so see your doctor as soon as possible. Consult your gynecologist if you notice that you are getting yeast infections on a regular basis. You may require longer-term antifungal treatment to eradicate the infection and prevent future infections. Thanks for watching.